Sanjay, good evening.
Himali, good evening. Good evening. Good evening, all.
Ma'am, please start.
Good evening to one and all. A very warm welcome for today's session on tips for office practice for the pediatricians. It is a new program started by our MahaAP for this academic year and will be useful to the general pediatricians in their practice. They rightly say being a pediatrician is like being a detective. We have to solve each child unique puzzle. So I would like to welcome for today's session our expert, Dr. Himali Mishra Madam. Madam is a moderator. She is a pediatric gastrohepatologist and currently working as assistant professor at pediatric hospital, AIMS Hospital in Nagpur. And we have I would like to first start our session with our president. I welcome Dr. Ramgopal Shijara sir. I request him to say a few words. And I would also like to welcome Dr. Amol Pawar sir, who is our secretary, MahaAP. Dr. Gravita Raikar, co-chairperson, MahaAP Women's Wing. Dr. Sanjeev Joshi sir. Sir is a central IP member, AB member, and also a pediatrician assistant, associate of, he's a president of Association of Pediatric Neurology and consultant pediatrician. I would like to welcome Dr. Pramod Jog sir and Dr. Shiva Vishwanathan sir. Requesting Dr. Ramgopal sir to say a few words. Over to you, sir.
Good evening, friends. Thanks, Amruta. Welcome to the second episode of Tips in Office Pediatric Practice. Respected today's guest of honor, Dr. Ajay Srivastava, sir. Today's faculty, Dr. M.S. Vishwanathan, sir, and Dr. Pramod Jog, sir. And today's moderator, Dr. Himali and Dr. Sanjeev, sir. The concept of tips in pediatric practice, we have started just for the general pediatricians. And today we have two experts for this. Dr. Vishwanathan, sir, he would be covering functional abdominal pain and constipation. And Pramod Jog, sir, though he would be covering the crying infant, but I am 100% sure that he will make us laugh.
Oh, no.
So without wasting much time, I would request Dr. Ajay Srivastava, sir, to say a few words, and then directly we will start the program.
Thank you, Dr. Ram Gopal sir, for inviting me and giving me this opportunity to address you all. And it's a mammoth audience, 259 right now. So it's great. My sincere regards to Dr. Pramod Jog sir, one of the most loved and respected speaker of unmatched style, you say, president of CIP 2016. And my regards to my friend Dr. M.S. Vishwanathan, who is a renowned pediatric gastroenterologist, and Dr. Sanjeev Joshi, who is chairperson neurology chapter. And along with Amol Pawar, these three are our jewels to our CIP team 24 under the leadership of Dr. Basav Raj, who is known for his super dynamic and say inclusive leadership with IIP की बात community के साथ. Our mother organization has made a giant leap and trying to be a part of people's life for authentic and easy answers to their questions. Someone has told it right that pediatricians are only professional in the world who strive hard to make their clients so knowledgeable enough that may hamper our own prospects in future. And with rollout of about 200 action plans, which are well managed as well as decentralized, till July, all over India, the academics are pouring like tsunami. And with this endeavor, which we are creating a whole lot of young faculties who will be torch bearers in future. And coming back to this program, top program, this is tips on office practice. This is wonderful. And continued learning in this digital era is now absolutely your choice in comfort of your home environment. After all, importance of learning cannot be described in words. So in 4 lines, I would sum up like, hello, can someone mute all others? So, wait, someone is singing a song on my tune. Okay. So इल्म की रोशनी से जगमगाते रहो. इल्म means knowledge. Knowledge की रोशनी से जगमगाते रहो. सफलता की उड़ान को पंख लगाते रहो. सिर्फ बातें नहीं, ये जिंदगी का पैगाम है. जब तक सीखते रहोगे, जीतने का काम है. और अमिताभ बच्चन ने भी एक बार केवीसी में बताया था कि सीखना बंद तो जीतना बंद. बट द इम्पोर्टेंट थिंग इज दिस लर्निंग ना. It is a quick reminder to all of us that to be an active learner is also a big art. First, we have to come out of notion that I am the best, and then अपने भीतर के अहम को निकाल कर, अपने भीतर के अहम मीन्स ईगो को निकाल कर ऊंचा उठना होता है. बादल वही ऊंचा उड़ता है जो सबसे हल्का होता है. So thank you, and I express my all the best wishes for the success of this program. Thank you very much for inviting me.
Thank you, sir.
Thank you. They're very beautifully said. Now I request Himali Madam, our moderator for today, to start with the session.
Yes. Good evening, all. I'm Dr. Himali Meshram. I'm a pediatric gastroenterologist and hepatologist in Nagpur, currently working in AIMS Hospital in Nagpur. Today, we are going to have a very interesting session on a very common topic, that is functional abdominal pain and constipation. This is one of the very common symptoms which we see in day-to-day practices. Though is it common, it is very important to differentiate if the pain, abdominal pain is functional or not, because on the basis of that only, the treatment strategy will differ for each patient. For the same, we have our expert, Dr. M.S. Viswanathan, sir, who will help us to discuss about these common symptoms and also clear the myths regarding the abdominal pain and constipation. I would like to give a short introduction. So M.S. Viswanathan, sir, is a senior consultant pediatric gastroenterologist and hepatologist currently working at Apollo Children's Hospital, Chennai. He has done his fellowship in pediatric gastro, hepato, and liver transplant from King's College, London. He is invited reviewer for scientific abstracts for various international conferences. He is also invited speaker in many national and international conferences. His special interests include food allergies, pediatric liver transplant, pediatric nutrition, IBD, and many more. So I would go over to Vishwanathan, sir, for his talk.
Good evening, everyone, and thank you very much. 1 second, I'm just in a meeting. I'll call you back. Thank you. And good evening, everyone, and thank you very much, Dr. Himali, for the kind introduction. And first of all, I'd like to thank the Maha IAP President, Secretary, and Treasurer, and all the office bearers, and for the kind invite. Of course, I would like to thank my friend here, guest of honor, Dr. Ajay Srivastava, who's a vibrant VP. And also we have Dr. Sanjeev Joshi and a senior pediatrician, Dr. Pramod Jog is there, and other all senior pediatricians. Actually, it's a pleasure to talk one of the elite state IAPs in the country and who leads the IAP, Central IAP in many ways. Thank you very much indeed. And let me start the screen share. And I think there are two big topics, honestly, to be honest. FAP and FC, actually, there are two big topics. I just want to know how much time I'll be given. I just want to know that so that I can plan it accordingly. Dr. Himali?
Sir, 30 minutes.
Okay, fine. So I'm just going to start with...
I think
20. Sorry?
I think Vishwanathan, 20 minutes for the talk and 10 minutes for interaction. Since
Okay.
Your moderator is one of the gastroenterologists, hepatologists. So
Sure.
आपके दोनों की जुगलबंदी, it will be really a treat for the audience.
Sure. The only thing is this topic itself takes a long. Let us see whatever I can do. I don't want to rush through. But anyway, I'm just going to talk about the functional abdominal pain to start with. Are you able to see my screen fully? Yes, you're able to hear me nicely?
Yes, sir.
Okay, thank you. So I'll be talking about functional abdominal pain to start with. Then, depending upon how time is, then we'll move on to functional constipation. And so basically, I'll give a little bit of background about the various terminologies, and then I will discuss about the alarm signals, about the various functional abdominal pain, the criteria, the categories, a little bit of the investigations, and of course, to give some take-home messages. And FGID, you all know that nowadays, in another 10 years, you won't be hearing the word FGID. You'll be hearing the word disorders of gut-brain interaction. That is going to be the word in another few years officially, formally. And basically, it's one of the most prevalent pediatric disorders. If you ask the pediatrician, at least in their practice, they will see every day 5 to 10%. For me, even it will be around 25 to 30% every day. So the problem is it's not actually we're talking about mortality, we're talking about the morbidity. The children missing the school, the parents missing their working hours to take care of the children at school, at home. And that's also, there is a slightly more issues of psychiatric illnesses. And most important thing one need to remember is functional GA disorders. 1 or 2 can overlap. And not only that, in an organic disease, there can be an associated functional GI disorders. Just because somebody is having organic GI disease does not mean they don't have functional GI disorders. That one thing I want you to all to remember. Terminology clarifications. Nowadays, we are using the word chronic abdominal pain and acute abdominal pain in a broader term. Chronic abdominal pain is any pain which is there for a minimum of 2 months. Doesn't matter whether it's intermittent or constant, it's for 2 months. And it can be organic and it can be functional. In this functional, it's around approximately 80%. And one needs to remember the psychogenic pain is totally different from functional abdominal pain. That we need to be very clear about that. So in Rome 3, what they used to say is, you diagnose functional abdominal pain after making sure there is no identical anatomic, biochemical, metabolic, inflammatory, or immunological disorders. But now, the Rome 4, which is from 2016, and they very clearly says, if you are unable to explain the disease to an underlying organic disease, you are fair enough. You can make a positive diagnosis of functional abdominal pain or functional disorders. You do not have to evaluate extensively. That is a very important message. So basically, we used to use this word recurrent abdominal pain. This was coined by Apley decades ago. And this is actually to characterize the type of the pain, which basically 3 or more episodes of pain, which actually interfere with the child activities. You can use this to characterize the pain or describe the pain, but this cannot be used as that diagnostic terminology anymore. So when a child comes to you, you want to know, is it organic or is it functional? Am I going to apply this Rome criteria? Do I need to involve all this associated health professionals like psychologists? What do I do? Is it a waste of time? Or am I going to go for strict evidence-based medicines? Or am I being forced to give medicines just because the family entered to my room with the child? So these are things we are all worried about all the time. What exactly happens in functional abdominal pain? Just only one side. I won't be talking about too much about pathology and all. Basically, you have a predisposing factors, a genetic predisposition, and the medical events. That could be abdominal distension, that could be a motility issues, or visceral hypersensitivity, or underlying inflammation, which could be triggered by an infection or an allergy, or then an underlying psychosocial factors. All these things can lead to an abdominal pain and then other GI issues. Let us keep it simple. So, as I mentioned, Rome 4 criteria is developed in 2016, and there are a lot of categories. They give classification for all the GI disorders from neonates up to adults. Under that, H2 is a section which classifies, which talks about childhood functional GI disorders. If you see from neonates to teenager, you can see loads of functional GI disorders are there. And today we'll be talking more about the functional abdominal pain, this 4, and little bit of functional constipation. What I'm not going to talk today is about this, which is in infants and toddlers. Any of Pramod Jog will be talking on crying infant. He'll be covering about something about infant colic, etc. I feel. But what I will be talking today is more about this functional GI disorders in adolescents and children, and much more focused on, if you see the functional disorders, functional nausea, vomiting, and you have functional abdominal pain disorder in the middle, then you have defecation disorder. So I'll be talking more about functional abdominal pain disorder, which is again classified into 4 broader categories, which is dyspepsia, irritable bowel syndrome, migraine, or if anything doesn't fit into criteria, then you call them as not otherwise specified. You have a functional dyspepsia. Again, there are 2 broader categories. One is epigastric pain syndrome, postprandial distress syndrome. So what is dyspepsia? You have a boy or a girl presenting to you with pain in the upper abdomen, epigastrium, for a 2 months period. You know, you have a criteria at least once per week or something like that, but they are not associated with any change in the defecation or change in the stool forms, and you are unable to find anything, then you can just say that this is a functional dyspepsia.